Please can you remind me, if you'll be so kind, staring out into space, asking God to hear my case, trying to think of all things past. How long will my memory last? But purple angel, purple angel, purple angel, you're next to me.
Hi, everyone, and welcome to Alzheimer's Speaks. I am your host, Lori LeBay, and I started Alzheimer's Speaks because my mom had dementia for 30 years, and I thought there was nothing better than talking and learning from people who are in the trenches, people who have really experienced what it's like. And so I am thrilled today to have a wonderful guest all the way from Australia with us. We are going to be talking with Leah Bisiani, and she is a registered nurse with a master's in health science, and she has over 35 years of experience working in the aged and dementia care field. And she has really established herself with highly skilled kind of knowledge base and has been established as a global leader, which is always fun for me to meet other people who are really pushing things forward. I've actually followed her for many years with her work via social media, and I would encourage you to do that as well. Leah is passionate and she's dedicated to utilizing progressive approaches to obtain the highest possible quality of life for people living with dementia. And I think that that's something that we don't always talk enough about, that whole quality of life issue. So I'm looking forward to kind of diving into that. Her primary vision has really focused on changing negative cultures and philosophies of care and providing a voice that confronts current practices and advocates for the rights of those living with dementia. She has successfully demonstrated how creating environments in which the person with dementia can continue to thrive, really by enabling them to continue to live life based on full recognition like we all do, and really value the individuality of each and every person with dementia. What are their preferences? What are their choices? She distributes and writes her research and articles in medical journals and aged care sectors and community. And again, I would highly recommend following her. And one of the things that I loved was she said, I really like to follow Gandhi's advice. Be the change you want to see in the world. And she has really stepped into that fully. And so thank you for being with us today, Leah. I can't wait to have this conversation.
Thank you so much for having me as well, Laurie. I mean, I've been following you also on social media for quite a number of years, so I feel very privileged to be here. Thank you.
Well, good. Before we get started, I always like to ask every guest pretty much the same question, and that is, have you been personally touched by dementia within your own family or circle of friends?
Not within my family. Fortunately, neither of my parents or my grandparents had dementia or lived with dementia. I have definitely been touched by dementia with friends who have had family members living with dementia. It's been actually a great honour for me to be able to assist them through and navigate through that journey. However, no, not in regards to my own personal family. My personal family's been afflicted with cancer most of the time, and I've lost both my parents to cancer. So when you deal with those type of conditions, you can actually put into perspective that those type of conditions are a lot more negative in regards to the suffering that is caused, because people living with dementia can live well with dementia, whereas people living with cancer and some other ailments.
Agree. Well, thanks for sharing that. It's always helpful for our audience just to kind of get a reference point. Now, for most people that really stand up and become very active in the realm of dementia, there's a defining moment that just kind of pushes them down that path. Did you have one of those moments?
Yeah, I did. I absolutely did, which it actually took me by surprise. And I was quite young. I'd just finished my registered nurse training, and back then we were hospital trained, so we didn't learn in universities, we actually learnt on the job. So from the age of 17, I was thrown into a hospital situation, the acute sector, and did my training there. And after I finished my training, I decided to go into aged care. I felt that was an area that I could lend myself to, and I was very interested in looking at the care that was being provided at the time. Now, when we think about it, this was 35 years ago, so it's a considerable amount of time ago, and 35 years ago, the conditions that people were being cared for under were actually quite horrific. And I remember walking into aged care and being so appalled by what I was seeing that I immediately questioned the caregiving industry. I was as opinionated as I am now back then, but unfortunately, as a junior nurse, I had no clout. What I would say, I would question and challenge what was going on, what I was seeing, because what I was seeing was gross neglect, and it was on a grand scale. I can still smell the smell of neglect. I can still see it in my mind. It affected me in such a way, and that was the catalyst to me wanting to create change, because no one would listen to me back then. I was too junior. I was told if you don't like it, you can leave, which I did do. I would never stay anywhere that condoned that level of neglect or abuse. And what I did see was people living with dementia were the ones that were at that stage suffering more than anyone else because of that neglect. And in my mind, I knew there had to be a better way. I knew that this wasn't caregiving in the true sense of the word. I knew that the essence of care was not actually being delivered to the people in aged care. And because it horrified me so much, I decided then to start advocating and becoming the voice of the people that could no longer speak up for themselves. And that's where it started. And then I knew in my mind as a 22-year-old how I needed to get myself into a position of power where I was the one that called the shots, basically, that I was going to create that change, that I was going to make a difference to the lives of these people. At this stage, I only really thought about within Australia, because we didn't have the internet, we didn't have all of this, the ability to promote our work internationally so much back then. But as I became, as I got myself into a situation where I was in more managerial type of positions, and then I did my master's and got published, by that stage, the internet was in place, and it enabled me to actually publish and promote my work globally, and that was the springboard and the leverage that I needed to be able to get my work out there around the world and actually prove to people by my research that people can live well with dementia, that we've got it wrong, that the stereotypes and the stigma associated with dementia is really more about our own inner fears and impressions associated with dementia, and that if we actually look at it logically and realistically, we can actually create models of care and understandings that promote people's rights in living a dignified life, even though they have a diagnosis of dementia. It's about us stop or not defining people by a condition, and understanding that dementia does not in any way take away a person's personhood or strip them of their humanity. And unfortunately, the attitudes about people living with dementia for a very long time have been pretty much associated with those types of attitudes.
I totally agree with you on that. I had a similar situation, kind of, that was one of the stepping stones for myself. I had a great aunt in a nursing home back in the day, which was probably 45, 50 years ago now. And when you talked where you can still see and smell, I mean, I can smell the urine, I can see the darkness, I can see people drooling and strapped in wheelchairs and, just not communicating. And I remember thinking this has to change. And I love what you're saying about the personhood and, the dignity. Nobody wants to be a diagnosis. I don't care if it's cancer. I don't care if it's dementia or heart disease or diabetes. You want to be known for, yourself. I think because there's so much fear wrapped around the disease, because there's so much unknown. One of the questions I wanted to ask you, because I have an issue with like the terminology and the words that we use, because I don't think that I think words affect our outcomes and our expectations. And I wanted to get your feel on that. What is your belief associated with the terminology that we use regarding people living with dementia?
Oh, I have a big problem with the terminology associated with people living with dementia. This type of subjective terminology, such as assuming a person suffers or is a burden or loses oneself, is a victim or a patient, or is afflicted, all of these words that get tossed around continually are very demeaning and derogatory, and they immediately provoke this dehumanizing attitude based on our own cognitive personal opinions. It's very subjective. These words are described in a way that make people think negatively about dementia. And if we actually continue to use this type of terminology, then we're actually proclaiming that people are suffering, or that they're afflicted, or they're not living well with dementia. And if we're actually projecting those type of feelings out there, then that creates this negativity around dementia, and then it affects how we feel about dementia. It then affects how we actually approach a person living with dementia, and that in turn affects how that person feels about themselves. So what we're actually doing is creating the suffering. These people aren't necessarily suffering because of a medical condition, no different to if someone has any other medical condition. So yes, all medical conditions create a situation where we have to rethink how we live, but we adapt ourselves accordingly. And there is no difference to a person living with dementia adapting to living with the condition and living with it as well as they possibly can. So this negative terminology definitely needs to change. That's why I call people living with dementia people living with dementia. I'm not going to sit there and call them a patient, because that depicts suffering and illness. And I know through experience, and I know people living with dementia who don't actually suffer or live negatively because of it. They don't let this diagnosis define who they are. They still are people in their own right, and we need to honour that and allow them to live well with dementia. You know, I have a friend by the name of Kate Swaffer, and she lives with dementia. She's actually a global leader also in regards to telling people what it's like to live with dementia. She travels the world, and she's had dementia for a good, I think it's about 12 or 14 years. And she won one of the most 100 influential women in the world last year. And she defies that stereotype every single day and proves to people that you can live well with dementia. And I actually believe that the only people that can tell us what it's like to live with dementia are the people that live with it. And they are our teachers. They are the only true experts, because the best we can do is assume. And they're the ones we need to listen to so that we can understand dementia and enable these people to live well. She always says that, you know, when she got her diagnosis, and I would assume that this occurs with most people living with dementia, they're told basically you have a diagnosis of dementia, It's the end of the road. You may as well get your affairs into order. So what we're doing is immediately disabling people and taking away their ability to live well with dementia. So she talks a lot about enabling people and empowering people living with dementia to continue living well with dementia, despite getting a diagnosis of that kind.
Yeah, I so agree with you, and that's really one of the reasons I started Alzheimer's Speaks was
Yeah.
to raise everyone's voice and to be able to give people with dementia a platform to be heard, because no one was letting them talk. I mean, still here in the U.S., we don't have many opportunities for them to even speak at conferences, and it's just so sad, and it's not valued. And I would love to see their voice heard at the doctors' conferences and the nurses' conferences, where they're really able to interact and learn, because they change people's perspectives pretty quickly. Because even some of the most renowned people that we look up to in terms of the realm of dementia still don't have that inner insight if they really haven't connected with the people living it. You know, if they're just going off their book smarts and what the computer tells them they should say. And like you said, when Kate mentioned about going in and, you know, kind of the end of the road, get your affairs in order. Well, how uplifting is that? And no extra resources. Here in the U.S., they're lucky if they're even given the phone number to the Alzheimer's Association. And they're really, we hear that story over and over and over, and people are shocked because they know with other diseases that is not happening. And so big changes have to be made, but we can't do that without having comfortable conversations, not ripping anybody down, just saying it's time to change. One of the words that, you know, I really have a tough time with is the word behavior. Because to me, behavior is a scolding thing. I don't think I've ever been told that's a wonderful behavior. If they like it, it's a skill. If they don't, it's a behavior. And yet we use that word over and over and over instead of realizing that it's just a reaction. And we all have reactions, and we as care partners, we can look for the triggers to try to alleviate that discomfort, because usually it's regarding some form of discomfort where something is coming out what we think is sideways because it's not fitting in our box anymore. And people are just shocked sometimes when you have that conversation and just have them think about the words that we use, because they're just so rote. You know, it's what we've always said, it's what we've always done. And so I think, you know, people like you and I and Kate and so many others out there having these conversations, pointing these things out makes a big difference. And those are things that don't, you know, they don't have to cost money. They don't have to take time to change, but they have a huge impact when the change is made, when it's really inhaled and you know, people walk that talk once they understand. Because I think everyone's goal for the most part is for people to live comfortably, but we have to teach them how, because for so long, I don't know over in Australia, but I can say fairly frankly here in the US, we use fear to raise money. And that's kind of been the goal behind everything. And so there's this big switch in terms of even showing a younger face like Kate's and like, you know, Harry Urban and, you know, so many others that are out there. People are shocked. It's like, oh, they have dementia? I wouldn't have known. It's, you know, it really can be an invisible disease until the later stages. And you know, that's something that's really important, I think, to change. Why don't we discuss some of the challenging issues that you see surrounding behaviors or reactions in the lot of dementia? Why is that?
A lot of these negative assumptions started to occur surrounding behavior, and people started defining people living with dementia as behaviors. I mean, we've all commonly heard people talk about the wanderers. And, you know, all of those type of behaviours. And I really question where we get off defining people as behaviour, because what I want people to understand is that behaviour is not something that is actually just about people living with dementia. We all exhibit behaviour every single day, every single one of us. So what we have to do is stop actually promoting this type of approach to actually saying only people living with dementia exhibit behaviour. We all exhibit behaviour if our needs aren't met. So by labelling and judging people for the sake of expediency in this way is actually boxing people and actually suggesting that only people living with dementia exhibit behaviour. So this is the first myth that we have to dispel, because it is based on very archaic, ageist and negative stereotypes. And these imageries are essentially incorrect and inappropriate. I mean, how often do you hear people living with dementia discussed as inappropriate or disruptive or problematic? So what we have to understand is, if our needs aren't met, do we not exhibit behaviour? Number one, as I just said, if I'm upset about something, I get cranky, but no one says I'm exhibiting a behaviour. If I have a really bad day at work, I might get home and I might be a bit anxious, but no one says I'm exhibiting a behaviour. If I go for a stroll down the street and I window shop for 5 hours and don't do anything, but I'm just going for a stroll, no one says I'm a wanderer. So when people living with dementia are expressing themselves through their behaviour, maybe what we should do is look at it from a different perspective. Maybe what we should be doing is looking at life through their eyes. Now, people living with dementia have what's called a lowered stress threshold. People living with dementia have a condition that does destroy their brain cells. So why is it that we sit there and judge them on having a condition that they have no control over and that they have not chosen to have, when we're the ones that are actually cognitively aware and should have a little bit more flexibility, understanding what's going on in regards to the condition that they live with every day? The fault lies directly with our behaviour in generating this attitude about behaviour. When we look at people living with dementia with that lowered stress threshold, because the capacity to deal with stress does change because of the damage that is occurring to their brain, they've got a disability. And so we need to actually look at that and be mindful of the way we treat people, and actually understand that when they are expressing themselves through behaviour, just like with us, they are in fact trying to communicate with us in the best way that they can. So instead of judging them on communicating, maybe it would be much better for us to learn the language of dementia, per se, and understand that they're living in a world that it's actually a privilege for us to share, and that they can provide us with a lot of insight and inspiration by understanding what it is they're trying to communicate. So when we talk about these triggers to behaviour, a lot of the time it's our approaches that are the triggers to these type of behaviours, because what we're not understanding is we're dehumanising and disrespecting them by judging them on these behaviours, when in fact what we need to do is adjust ourselves accordingly and understand what they're trying to communicate to us by their behaviours. Because they might not be able to say to us, hey, I don't like that, or hey, that's not how I've lived my life for the last 50 years and you've changed it and that's making me really anxious. Or hey, I'm in pain and you're not doing anything about it. Or hey, you know, I'm trying to tell you that I actually want things done this way and you're disrespecting me by doing it that way. And this is where a lot of behaviour comes through. And so we're actually triggering those behaviours by disrespecting the rights the human rights of the people we care for. And if we actually honour people and actually respect their personhood, then there is no need for them to communicate through their behaviour.
I totally agree. One of the things when I'm out speaking and training is, I tell people that we have to look at our commonalities instead of our differences, because, when we start pointing out that somebody's different, we create these barriers and these walls. And so one of the things that I teach people when I'm out there, I think that fits what you're talking really well, is I say we all use the same equation for our reactions. And that equation is, what is our current attitude? What are our past experiences? Because those create our perceptions, and that's what triggers a reaction. And when they look at it like that, they go, oh, that makes a little more sense. And then we have to, like you said, we have to put on our little investigative hat and go, well, what triggered it? And, you had said a lot of times we're causing this. Many times we're the one coming in with the mood. They were perfectly fine before we entered the room. And now they're mirroring our mood back to us, but we called them out on it.
It's our behaviour that's actually creating behaviour in others. And it's not just with people living with dementia, it's anybody. Our behaviour, it's what we put out, we get back in return. And that applies to life.
Exactly.
Not living with dementia, but, as practitioners, we make erroneous choices for people living with dementia and allow our prejudices to take precedence. So we misrepresent their sense of personal and individual characteristics. And we cease to adjust ourselves to meet those specific and distinct choices of the people we're caring for, and actually take away who they are. And when you look at that, that's really cruel, really cruel. And it makes me question why, even now in this day and age, we strip people of who they are and the place they hold within the world so callously.
Correct me if you think I'm wrong, but I think the world is moving so fast, and people are they're plugging through things, and we really aren't, we aren't reading people anymore. We're interpreting words or text, which in emails that get us in a lot of trouble, because that whole emotional piece is missing, and you don't really know what they meant. But we're taking it and swallowing it, and then we're gonna make that decision. And with the person with dementia, it seems so sad to me, but there's this force aspect of talk to me, say a sentence. And they're not looking at all the nonverbal signs, which over 3/4 of our communication is based. And so we have to, kind of tell people, look for the glint in the eye or the glare that they're upset. Is their body, tight, and are they frightened? Are they mad? Are they clenching their teeth? Do they have a twitch, or are they happy? Are they smiling? Do they have dimples? What is your read? We have to go deeper. I think we've gotten to be a real shallow world on a lot of levels. And to me, one of the biggest gifts that dementia gave me on my journey with my mom was the beauty of slowing down, of paying attention, of being present, of learning to play again, not always having to be in control, learning to be more spontaneous, and, follow the detours. Sometimes they lead to real cool places, but we get so pinned down with, we have to control, and we have to do this, and we put all these time frames on us that really cause a lot more stress, not only for the person themselves who's caring, but for the person they're caring for, because they're able to read all those nonverbals, and they tell us that all the time. Don't talk to me and face me, because I'm reading all of this. I'm reading your lips, and I'm reading all your nonverbals, and people are shocked that they can do that. And so it really is about respecting relationships, not handing the relationship over to the disease.
Again, we're the ones that are cognitively aware, so you would think that we would be able to adjust ourselves accordingly to the changing reality of a person living with dementia. I mean, they exist in a world which it is actually a privilege for us to share. They communicate with such great authenticity that we can learn a lot from that. And you know, they provide us with the insight and inspiration to become better versions of ourselves by understanding people on a deeper level. And when we ignore that, you know, and don't try to fathom the world that they're trying to communicate to us, it really means that we're actually just disregarding who they are immediately, and this is what's so disrespectful. So when we're endeavouring to fathom the worlds of a person living with dementia, we should really attempt to capture these conflicting perspectives and scrutinise the understanding of what we're perceiving, because really, again, we're at fault here. And hence, we may recognise and attempt to upkeep the person's reality as their own personal truth. And if we truly listen to the behaviour of any person, not just a person living with dementia, then we can attempt to understand those methods of communicating, which means that we're opening up a whole new world of connection and interaction. And I was teaching some people last week. I was doing dementia workshops here in Australia, and that was one of the things that you said just resonated with me in regards to how much of the verbal aspect of communication do we rely on, and we do become very reliant on that verbal aspect. And I asked everyone in the room to tell me how much of the verbal aspect they think is relevant, and most people said over 50%. It's actually 7%. And the rest is non-verbal, and the rest is, you know, it's like tone, gesture, facial expression, all those type of things. And everyone's like really shocked. And I'm like, no, it's actually a very small amount of how we actually do communicate. And so we do become very reliant on that, and we do stop recognizing and reading people's body language, and that is definitely one of the most important factors in communicating with people living with dementia. And if we can only adjust ourselves and start using those ways of communicating, then all of a sudden we can actually meet a person in the middle there and engage on a different level, and allow them or allow ourselves to open up those avenues of communication again. And it works.
Yeah, one of the things that I really feel that people, they have this sense of loss of hope. And you know, if we think back to when a child is small, you know, their ability to communicate by words is minimal, you know, and not at all really, except maybe a cry. And is that a good cry or a bad cry, or you know, what is that? But we forget that even as a small child and as a toddler, even when their skills aren't at an adult level, you know, that we feel that we've earned, there is joy, there is happiness, there's true connection. And so if a lot of times I think people look at a person with dementia as declining and that all being negative. And like you said, they become so authentic. And so many of them that are advocates say, I feel more purposeful now in my life than I did before.
Yeah.
You know, they know they can help others. They know, you know, that they've got these great abilities to communicate and lift a hand. And we need to help raise that. We need people to understand all of the gifts that they have to give us, you know, within that. And again, I think part of our jobs is creating that hope and to show people there could be great joy. It might look different than what it used to, but that doesn't mean it's any less valuable. In fact, I think as we go down on like Maslow's theory, you know, I think it's the base that brings us the richest things. It's, for my mom, who now has been gone for 5 years, it's not the big, fluffy, flashy stuff that was in our relationship when I was a kid or an adult, before illness. It is the glint in her eyes. It's the giggle. It's the dimples. It's the smile with the broken teeth that melt my heart. And those things are never ever going to go away, because you come to learn a true peacefulness, not just a facade, because we're all good at the facade stuff.
Yeah.
But you really get to that authenticness. And I think so many people are so afraid of the disease that they are missing such a big, beautiful piece of life that could really help them in all areas of their life.
I think that we only focus on the negative. People forget that people living with dementia retain a lot of strengths, and we need to actually tap into those strengths to enable them to maintain their independence and live well. And as you said, we become very caught up in the fear associated with the condition. And it is all based, our reactions to dementia is based on our own subjective fears. And unfortunately, we put those fears on the person living with dementia, and then that's going to affect how they live well with dementia. It's very true. And this is what we have to turn it on its axis. We have to actually show people how to rethink dementia and not to be any more fearful of dementia in regards to any other medical condition people might have. We have this overwhelming fear from dementia that we don't get with other more chronic and debilitating conditions. And it really makes no sense. And it's only because people fear dementia in regards to the cognitive aspect of it. But they don't understand that losing cognitive ability doesn't mean losing oneself or the place one holds in the world. And this is what we have to show people and prove. And people like Kate are perfect examples of that. And, these attitudes that we have actually, unfortunately, create inaccurate perceptions about dementia and instill that really pessimistic mindset that we pass on to the people that we care about. And we need to take a step back.
I agree.
And we do need to rethink dementia as caregivers, as health professionals, as a community. Humanity need to get over themselves. And the way we think is very rigid, and actually open our minds to a condition and actually, instead of creating situations where people can't live well with dementia, actually create a situation where we promote a wonderful, uplifting lifestyle, as in my business name, Uplifting Dementia. Because even though it's different to how we perceive life should be at this time of our life, it doesn't mean it's wrong, and it doesn't mean it's bad. Life throws us lots of challenges all the way through, and we adapt ourselves accordingly. We don't seem to be able to do that with a diagnosis of dementia.
Yeah.
And this is where we do need to create change.
I agree. One of the things I wanted to talk to you about too was chemical restraints. I know you're real passionate about that. And for some people don't even know what chemical restraints really means, but it's the medication era of give me a pill and fix me type thing, or fix them. And I'm with you. I am very passionate about using as little as possible because they all have side effects and so forth. What is your thought regarding medications?
Okay. First, I'll just make a little disclaimer that there are going to be some people that respond well to medications, whether it's for their heart disease. People need to take medications. If people are in chronic pain, they need to take medications. Some people do have psychiatric disorders which they require medication so that they can live well. When I talk about chemical restraint and abuse, I'm talking about using and utilising medications for the wrong reasons. Usually to castigate, to make our lives easier, or to deal with that dreadful behavioural expression type of reason. So what I talk about when I talk about chemical restraint and look at it under the umbrella of elder abuse is when people use psychotropics and sedatives and tranquilizers to sedate people living with dementia. And they use these type of drugs for convenience. They use them under the proviso that they're actually protecting that person from risk. And they usually utilise them for behaviour. So in those type of cases, that's highly inappropriate and it is considered abuse. You do not medicate people for being different. You do not medicate people for trying to communicate. And you do not medicate people because you don't understand them. So therefore, when you do that, you're actually abusing that person's rights and you're actually creating a situation where that person is quite likely going to deteriorate a lot faster. Because these type of medications are designed for a certain purpose. They're not designed to drug people for convenience so that they sit in their chair for the rest of their life drooling. That's inhumane. That is brutal. That is barbaric. And when medical professionals prescribe these type of medications for people living with dementia, it just shows that they do not understand the condition and that they are actually not considering that person as a person in their own right or upholding the rights that they should be. The Hippocratic Oath is based on do no harm. And I would actually challenge that people who prescribe these type of medications for people living with dementia on the basis of behavioural management could actually be considered the executioners. And I know that that's very much confronting for a lot of people because a lot of people rely on these type of medications. But unfortunately, what's occurred is that these type of medications have become the norm, and we can't continue to normalise the over-medicating of people living with dementia and destroying their quality of life.
But I want to thank you for just clarifying things in the beginning about certain meds are definitely helpful and useful and needed because they are, but I think as a last resort in terms of trying to control behaviors, because a lot of times it can be staff training or staff ratio that it's being done for complacency to keep things
which means for
your
own convenience, right? And the other thing, see, when people say, oh, we haven't been trained, oh, staff ratios, oh, we don't have the funding, I say to them, but do you know right from wrong? Because you know what? They're just excuses. My daughter is not medically trained, but she would know that you don't medicate people for your own convenience. You don't drug people. If your child is having a tantrum in a supermarket, you don't drug them. If your dog is misbehaving, you don't drug them. If somebody is rude to you in the street, you don't drug them. We know right from wrong. I think that people that say lack of education and all these type of things are just making excuses. And I really can't condone that, because we do know what's right and what's wrong. When I started out in this area and I saw what I saw, majority of the people would be drugged to the eyeballs. And that's not a quality of life, and that's not quality of care. That's abuse, pure and simple. And anyone that has all these excuses and says it's okay because they haven't been educated is condoning that neglect, and they're just as bad as the people prescribing it. But that's just me personally.
I think it's hard though for like new staff coming in, because it's the establishment of it's always been this way, you know.
That's where the normalization comes in, yeah?
Yep. And that's where things really, really need to change. Just because it's always been this way doesn't mean it's a good thing. You know, is this how you'd like to live? Probably not, you know.
Yeah. And that's what we have to ask people. Yep. Would you do this to your mother? Would you do this to yourself? How would you feel if it was you?
Yeah.
Because once again, it's stripping people of their human rights. It's stripping people of their humanity. And this is where we dehumanize people living with dementia, and people actually feel it's okay to actually medicate people and over-medicate people, because they have this ideal about dementia that is incorrect. And that is definitely where education comes in actually understanding that people living with dementia are still human beings in their own right.
One of the things I would like to kind of wrap up with is, how have you proven that people can live well with dementia? Because I'm sure there are some people out here that haven't heard some of the things that we've said before. And so what would you say to them? What can you show them as proof?
I think the number one thing is see the person. You can't ever deny, you know, that person is not there. You know how people say, oh, I've lost my mother because she's got dementia, which is, again, making an assumption about the condition. You never lose your mother. You never lose a person until their last dying breath. We just need to learn how to regain those relationships and communicate on a different level, and understand that that person is still there. And once again, they can't be defined by the condition. My whole life's work has been about caring for people living with dementia in the residential aged care area. That's where I started off, and I have cared for people living with dementia, hundreds and thousands of people living with dementia throughout the course of my career. And in that time, I conducted a lot of research, because obviously in this industry, you need evidence and data to actually start dispelling all of those myths associated with dementia, prove that people can live well with dementia, defy all of those subjective stereotypes and the stigma associated with dementia and behaviour and medication, and that people can't live well with dementia, and show that you can actually empower staff and yourselves and the community in actually rethinking dementia and how it affects the people that are living with it on a day-to-day basis, and bringing back the humanity and bringing back the quality of life and all of those type of things. And so I knew that I had to do it myself to actually show people how to do it, because obviously I can talk all I want, but everyone's going to say, oh, but we don't have the resources, and we don't have the staffing, and we don't have this, and we don't have that, and you're wrong. How do you know that this is the way? So I needed to actually conduct my own research and prove all the doubters wrong by my evidence and by my data, and also working in an evidence-based industry that I do. I'm very much into creating situations where I do have evidence to prove that my theories are correct. Luckily, all my theories were very successful, and I was able to prove that people living with dementia can live a wonderful, exciting, uplifting, joyful life if only we allow them to. Really? Because once again, it's back on us. We're the ones that create the suffering. We're the ones that cause all of the issues that we complain about incessantly about dementia. The condition doesn't do that. It's our attitudes that we project onto people that do. So I ran aged care homes for about 20 years of my career. And in that time, I would only have people living with dementia living in my facilities. I didn't take anyone unless they had a diagnosis, because what I wanted to do was create environments in which I felt people living with dementia could thrive, and create environments where magic happens, you know. And so I managed to do that quite a number of times. I would train all my staff myself. I would create teams of strength, because obviously I'm only one person. I needed to instill and inspire the people that were working with me to believe in my dream, you know, believe in my dream of change. Be the change you want to see in the world, Ghandi, as I is, you know, really my motto. And actually look at the medical paradigm for what it is, actually challenge it and say, okay, a long time ago we didn't know very much about dementia, and I understand why these paradigms came into place. But in this day and age, I feel that we need to look at those frameworks and understand that they're very archaic and negative, and create new frameworks which make the old ones obsolete. Because another wise man by the name of Einstein once said, the definition of insanity is doing the same thing over and over again and expecting a different result. So what I was seeing is people doing the same thing over and over again, and it wasn't providing any quality of life or understanding or growth in the area of people living with dementia. So this is why I wanted to create new philosophies and new cultures of care that I felt were going to be much more proactive and productive in assisting people living with dementia to live well, giving them a voice, making sure that people understand that these are human beings and that they live with a disability. Stop actually suggesting that people living with dementia have a psychiatric condition, because for a long time it was put under the mental health umbrella for the sake of expediency, because people didn't know where to actually put dementia. But we know now that it's a disability, and so the care for a person with a psychiatric condition is going to be completely different to the care for a person with a disability. So for a very long time, we've cared for people living with dementia as if it's a psychiatric condition. And you know, that's another area where our fault in understanding dementia has created situations where their quality of life has been undermined. So if we actually have a fresh outlook and care for them as people with a disability, then all of a sudden you see people actually flourishing and blossoming. You actually, you know, look at every other condition, because, you know, a lot of people that we care for in the aged care situation, especially not people with younger onset dementia, but in aged care, have multiple conditions. They don't just have dementia. So if we don't actually manage all their other conditions effectively, then obviously that's going to make them decline more rapidly. It's not going to be usually the dementia that makes them decline so rapidly. It might be because we're not actually effectively managing their pain, or their unstable diabetes, or their heart disease, or their respiratory disease, or any other condition that they may have. And so it's like you have to look at a person as a whole, and then you have to apply that holistic framework of care, and not sit there and say, well, I'm going to get you to live your life this way because it makes my life easier. Actually honour that person and can allow them to continue their life as they know it, instead of saying, taking away aspects of a person's life for to make it easier to care for them. And if you actually respect that, then and recognize the essential unity of all human beings, despite what differences there may be in their physical or psychosocial or cognitive capabilities, then all of a sudden you enable people to live well. And so this is the way that I was able to establish change in an area, and have the research to back it, to prove that it can be done. And that's what I set out to do when I was 22 years old, was to just prove that there was a better way.
Well, I'm so glad that you took that path. And I love talking with you because I can hear the passion and the compassion in your voice. And what I'm hearing is, you're really trying to change the mindset to one of a heart set of how would you like to be treated? None of us wants to lose that dignity and personhood. We all want to feel purposeful. We all want to feel like we belong and can contribute. And there's still a lot of stigmas out there that we have to remove. And in order to do that, we have to show people kind of the light. We have to show them that there is a good side to this, that there can be a great life for the person with dementia and those around them. If, like you said, we just get out of the way and allow it to happen, instead of being a stick in the mud and just slamming it down every chance that we can get. Leah, now for people to email you, they can go to shimmeringsspirit@hotmail.com. That's shimmeringsspirit@hotmail.com. And you also have an Instagram account, which is uplifting. And then there is a line at the bottom, and then dementia. So uplifting, and then the line at the bottom, not the dash in the middle, dementia. And then they can also find you on LinkedIn. And those links are all on the radio page and the blog and the YouTube channel as well. Well, I can't thank you enough for spending time with us. I know it took us a while to coordinate, you being in Australia and myself in the US, but well worth it. And continue on. You're doing great work, and you've got a lot of followers, and I hope there'll be many more to come as you march down this path and make life better for all of us.
I'd like to thank you for the opportunity to speak and to chat with you. It's been an absolute privilege, and I just urge people to actually sit back and rethink dementia and actually look at life from a more compassionate and empathetic manner, and actually provide increased possibilities to enable people living with dementia to live a life free of the constraints that society place upon people that are different. I think that if we become more humane in our outlooks, then the possibilities are endless. So I thank you very much for allowing me to speak on your show.
Well, thank you. And we will definitely be in touch. I will continue to follow you. I love your work. So again, thank you so much for being with us.